In the last year, a total of 735 patients, an average of 2 each day, were treated in the Seattle Children's Emergency Department for mental health issues. Some of the top mental health problems that bring children to the ER include depression, anxiety disorders, eating disorders, bipolar disorder, and aggressive or violent behavior. When something happens that requires more than a Band-Aid and a kiss, it can be a fine line between a trip to an urgent care clinic or here to the emergency room. Here's a look at how to navigate that decision-making process.
I want you to look right up in the...
12-year-old Nick got a piece of burning ash in his eye at a bonfire with friends the other night.
We got some water so I could just splash it and try to get the piece out.
It's not bothering Nick too much, but it is concerning his mom.
It was swollen in red.
So Nick is here at Seattle Children's Urgent Care Clinic in Bellevue on a Sunday afternoon to get that eye checked. A lot of families come here rather than the emergency room when their concern can't wait for regular clinic hours.
I think the main thing to think about is if you think it's clear that your child is very, very ill and may need to be admitted to the hospital or have a procedure done that's going to require subspecialty care, that you should probably go to the main emergency department. For more kind of minor complaints, a lot of the cough and cold complaints and sore throats and ear, does my child have an ear infection? That's something we're very capable of dealing with here.
Sometimes it's hard for a worried parent to decide between the ER and an urgent care clinic. Let's ask Dr. Josh Weldon for some help, starting with A, for allergy attack.
If your child has respiratory symptoms as a result of an allergy, like they have a known nut allergy and they're having trouble breathing, that's 911 or straight to the emergency department. If your child has a rash and you're not totally sure why, it's certainly something we can evaluate.
How about asthma?
Also depends a little on severity. We'll usually initiate that treatment here, but if it's clear that they're fairly sick and might need to be admitted, then we'll transfer them to the main ED.
B is for broken bone. Most can be handled at the urgent care clinic, but any fracture where there is visible deformity should be handled at the emergency room.
If your child broke their arm and it's sticking out of its skin, hopefully nobody wants that to happen, but if that happens, you need to go to the main emergency department because you're going to need to have sedation and see orthopedics and those kinds of things.
Minor burns, dehydration, diarrhea, all common reasons for urgent care visits. Same with E and F, ear infections and fever. Most cases can be seen here. H, head injury.
A patient who hit their head and had a very brief or no loss of consciousness is a patient that we're happy to evaluate here, but we do not have a CT scanner here. So patients with severe head injuries who are not back to their neurologic baseline or clearly have significant head injuries need to be seen in the emergency department.
There's an entire alphabet of reasons your child may need to see a doctor when their own isn't available. If it's life-threatening, call 911. For minor illnesses and injuries, though, an urgent care clinic is often the perfect fit.
Our job is to take care of patients and families close to where they live, and we enjoy doing that. We often really want to do our best job interfacing with people's primary care doctors.
7-year-old Ataya got very sick from an infection that required blood work and IV antibiotics. Dad and siblings enjoy a video game in the lobby. Her mom was happy to come here instead of the hospital ER.
I'm glad that, that the Children's Hospital is here in Bellevue. Instead of, like in Seattle, like we used to go. And the convenience, and it's closer to our house.
Don't worry if you guess wrong between the ER and urgent care clinic. Urgent care doctors and nurses here at the Bellevue Clinic can assess a situation quickly, sometimes consulting with emergency medicine providers, and decide on the most appropriate place for care. Almost every day, they transfer a patient from this clinic to the ER, either by ambulance or parent's car.
Why don't you lay back, okay? This is not painful, I promise. If it was gonna hurt, I'd tell you.
Nick got to get his eye examined with some cool glow-in-the-dark drops and a type of black light to check for damage to his eye. He'll go home with some antibiotic drops after a short Sunday visit with a
he
doctor
has a secondary
close to his
infection.
home.
Okay, you did great. Wasn't so bad, right?
In an effort to better serve the urgent medical needs of patients and families, Seattle Children's will be opening 2 new urgent care locations in the coming year. The plan is to offer urgent care clinics in 3 locations: Seattle, Mill Creek, and Bellevue. Similar to the urgent care clinic located at Seattle Children's Bellevue Clinic and Surgery Center, the 2 newest clinics will be open evenings, weekends, and holidays when your regular doctor is not open. Coming up, overcoming language and cultural barriers in the emergency room. How Seattle Children's works to speak your language.